chances are you are traumatized. That may not be a sentence that you want to hear, and that may not be a sentence that's easy to hear, but if you are like 3/4 of the rest of the United States, then you have been through some sort of traumatic event in your life. My name is Amanda Althouse, and I have spent the last 7 years working at an alternative high school here in the city that I live in, working with students from 9th to 12th grade, ranging in ages from 14 to 20. Through my time working at the school, I have been able to work with all sorts of different students from all sorts of different backgrounds and have really been able to dig deeper into the concept of trauma. I want to talk about childhood trauma today. I want to identify what trauma is, what I mean when I speak about childhood trauma, how would I identify a student who has potentially been through trauma, what are some short-term effects for these children, some long-term effects for these children, and what do we do as educators and just human beings to help move this very difficult and life-altering situation. So first I want to talk about what is trauma. So when I speak about trauma, I'm talking about the adverse childhood experiences that leave behind a painful or stressful physical or emotional experience. That definition is from the National Child Traumatic Stress Organization. So these things could be several different events. We could be talking about things that have happened to a child. We could be talking about things that did not happen, and a third type of trauma. When I'm speaking about childhood trauma, I'm talking about kids who are 18 and younger. This is not to say that trauma stops at the age of 18 or that it just goes away, but for the sake of this conversation, we're going to be talking about just 18 and younger. So what is trauma for children? Trauma could be things that have happened to them. The Blue Knot Foundation, which studies childhood trauma and post-traumatic stress disorder, tells us that things that could have happened to them. This is things, for example, like abuse. This could be physical, emotional, sexual abuse that happened to a child in the home, outside of the home, leaving behind those painful and traumatic memories. This could be things that didn't happen. Abuse. So things that, when I say abuse, I mean they watched this type of abuse. Another type of thing that wouldn't happen would be like neglect or abandonment. So maybe they're not properly being bathed or fed or cared for emotionally or physically. And the third type is the trauma from trauma. This term is also kind of known as the trickle-down effect. A Cleveland Clinic study talks about how this is when a parent is affected by trauma, and this then causes the child to be affected. So this would be things like illnesses. Maybe the mom or dad is really sick and they can't properly care for the child. Maybe mom or dad are in jail, or the guardian is on drugs or alcohol. Perhaps the parents divorced, and so now one home is having a much more difficult time caring properly for the children. These are all the trauma from trauma types. And so all three of these categories are what we would identify as trauma, ranging from things like abuse, like I mentioned, the neglect, drugs and alcohol, divorce, outside sources of trauma as well, car accidents, or perhaps living in a military family where they lost someone, or another type of sudden loss. All of these are identified as traumas. So when it comes to identifying trauma, so you don't just typically meet a student and they walk up to you and they say, hey, this happened to me. But when I walk into a classroom or I'm teaching a class, how would I identify a student who I believe has been through trauma? And how do you identify also as an adult someone who's had trauma? A study by the CDC was written about in an article from Harvard, and they discussed the concept of ACEs. So ACEs are adverse childhood experiences, and these are some of the things that I had mentioned before, where you're talking about different things that happened to you. But the ACEs test lists off 10 different things that could have happened to you between birth and 18 years old that they would consider a traumatic event to give you an ACE, what they would consider a point. So this is a 10-point system. And if you were to look up the ACE system, you would be able to take this quiz yourself. So some of those questions would be things like, did you feel safe in your home? Did you feel properly cared for? Were there times that you remember that you couldn't eat? Were there times that you remember someone physically harming you or emotionally harming you? And so when working with a student who I believe could be traumatized, of course, working with older students, we can actually fill out this ACEs test together. If that's not an option, I will look for some of the other short-term effects, which I'll move on to momentarily. But in regard to the ACEs, this is really a system that helps you identify what has happened and the chances of being traumatized from these events. So working with a student going into a classroom or working one-on-one, what are some of the short-term things that I would be looking for or that I would notice as an educator that might put up a red flag for me? So this could be things like excessive anger, loss of appetite. You notice a student isn't eating lunch like they normally should be. A student perhaps isn't concentrating or is having difficulty remembering things that they seem like they should be remembering. Maybe these students have low self-esteem or they don't have much confidence. Maybe they're isolating themselves. Perhaps they are doing risky behaviors or they're participating in self-harm. All of these short-term effects identifiers come from the U.S. Library of Medicine and the Journal of Pediatric Healthcare, and they identify various short-term effects that you could notice would point to a student or a child being traumatized. Of course, you will have your behaviors that happen just because kids are kids, but there are things that are really concerning, and these are some of those things. So when it comes to a child, a teenager that I'm working with, a lot of these behaviors identify to something that is currently happening in their lives or previously happened to them, and we can identify this child has ACEs, this child has been traumatized. It's really important to identify these things because if not dealt with, we've seen all sorts of effects into adulthood that come from these traumas and these ACEs. So psychiatry.org, and again, the U.S. Library of Medicine, talks about what could happen if you don't deal with these ACEs and you don't deal with these traumas. So a couple of things when it comes to the ACEs and becoming an adult to keep in mind, back to the study from Harvard, is that if you have an ACE, which 3/4 of the United States has had at least one of these traumatic events happen to them, the more ACEs that you have, the higher chance you have of dealing with various lifelong issues. Some of these issues could be things like you have a higher chance of poverty. You have a higher chance of poor health. You risk, when it comes to poor health, things like diabetes. There's been a proven risk of or increase of cancer. Lower academic achievement through childhood and then into adulthood. Less likely to pursue a future, a career. Early death is another side effect of these long-term traumas. So that's why it's really important that these are being dealt with. When it comes to the lifelong experiences, the behaviors, and the poverty and things like that, there's also another side of this, which is what happens to the brain when you have been through the traumas. So I did want to show this that I got from the Journal of Pediatric Healthcare, and I also found a similar one from a Cleveland Clinic study. And this is a photo of your brain and what happens when a brain has been through abuse. So over here you have the normal brain. You can see in this scan you have the temporal lobes and everything is as it should be. When you move over here to the abused brain, you can see that the temporal lobes and pieces of the brain have actually begun to dissolve and move around. This is actually wiring in your brain and pieces of your brain that have, what they coined the term, have been eaten away because of the trauma that you have endured and the stress that you have endured. So it's not just physical, outward things that you go through, but it's actually internal in the brain, things that change from this stress. So when it comes to other things that happen and tie with the brain, you see immune system changes, neurological changes, you see all sorts of different things that happen, such as the memory loss that we talked about. You see that your brain actually cognitively loses function from the stress. You see these immune system changes, so maybe now your body is not able to fight off infection as easily as it was before. Your mental health can deteriorate. All of these long-term effects that happen to adults because they had not handled or dealt with, identified the childhood traumas and the ACEs that they had been through. So we know now what childhood trauma is. We know why it's important to identify. We know how to identify it. So what do we do with all of this information? How do we avoid children turning into adults who face all of these health risks, all of these social risks, all of these long-term poor decision making, higher chance of drug and alcohol use, all of these negative side effects? And we're learning through all of these studies being done. Again, the Harvard study, the CDC study, when we talk about the ACEs and we talk about what they transition to now in adulthood, we learn that the most important possible thing that we can do is identify these ACEs. By identifying the ACEs, we identify the trauma that the child has been through, and we work through the trauma. The Substance Abuse and Mental Health Services Administration says that a student, a child who's been through the trauma immediately needs to seek care, mental health care. Some of the things that they recommend for working through these things are cognitive behavioral therapy. Psychiatry.org recommends a therapist in identifying and working through how to react. So psychiatry.org also mentions the flight or fight response, and we can learn to adjust these responses that we know so well by identifying if this is actually, what's happening is actually something that's concerning or it's a response to our trauma. And so by working through these things in therapy and by working through identifying what's going on in our adulthood, we're able to better process, better decision make, better move forward. And recognizing that this person, this child turning into an adult, is not always in need of living in crisis mode. They can better work through these things and become a healthy, happier, productive member of society. The most important thing that we can do, again, is identify these traumas and find ways to work through them. Peter Levin said, "Trauma is perhaps the most avoided, ignored, belittled, denied, misunderstood, and untreated cause of human suffering." And I think that really says it all, because if we can identify what has happened, of course, a lot of these things are unable to be stopped. And by the time a child gets to me, I'm not able to do anything about what has happened in their past. But if we can point out what has happened, we can learn to work ways around and through the things that have happened and not cast the shadow over someone who has been through these things. Then we can better to offer them resources and make sure that they are a productive member of society, their happiest and healthiest versions of themselves. Again, I really appreciate the time that you took listening to this. This is a really important topic as we think about how our society evolves and moves into making sure that we're all the best versions of ourselves. And unfortunately, that's just not possible if we don't work through the things that we've been through that have gotten us to where we are. Again, my name was Amanda Althouse, and thank you for listening to this about childhood trauma.